Okay, I feel a little silly doing this, but this is a assessment of a postpartum patient and then a newborn patient. We're using a pillow to simulate the patient. I'm going to try and do this as quickly as possible simply because it'll take a long time to upload on my really poor internet if the video is long. So excuse it going quickly, but initially we would walk up, we would talk to our patient, we would look at them. As they answered us, we would know their airway was clear. We'd do a set of baseline vitals: blood pressure, pulse, respiration, temperature, pain, pupillary response, listen to heart tones, good strong heart tones, S1, S2, no murmurs, scalds, or rubs. Hopefully we'd have clear lung sounds in all four fields. CVA tenderness. We'd listen to our bowel sounds. Hopefully they were, nice, not hyperactive, but good, even bowel sounds. Assess the bladder for distension. Look at the loca, Holman sign in their calf tenderness. We would check the incision if it was like the care plan we just did for a C-section patient. We would look at their legs. We would look for edema. We would look for, activity. We would question as far as postpartum depression. Yeah, hey, what's going on with you? How are you doing? How are you managing everything? Are you having any anxiety with the situation? We would probably go back over and do a secondary assessment, see if we had any swelling in our hands. Do we have any pain? Do we have anything that's abnormal, right? Question the patient: how are you doing with your meds? How are you feeling? Take a second look, make sure that we didn't miss anything, and then we would go on to the newborn physical assessment. So there again, our patient can't talk to us, but we would walk up. If the child was in his bassinet, we would look at them. Are they tracking us with their eyes? What's their skin color like? What's their respiratory rate? Hold your hand on his chest, see if you can count his respirations. See how he's doing with work of breathing. Is his skin pink, warm, and dry, right? Does he move his hands and his feet? Does he, is he active? How's he doing? Is he sleeping? Is he, if you unwrap him and move him around and start to look at him and assess him, how does he react to that? Does he seem to have any pain, right? What's his skin temperature? What's his actual temperature? We would want to know what he weighed, right? Because we'd want to know, has he lost any weight since he was born, which is normal, but that they haven't lost too much. Blood sugar, AccuCheck. We'd go ahead and weigh him. We'd measure him, measure the circumference of his head, measure the circumference of his chest. We would look at the texture of his skin, the turgor, languor, look for rashes, for Mongolian spots, all the things that we would normally assess for. There again, reflexes: blink, pupillary reflex, his startle, rooting, put something in his mouth like his pacifier, what he's sucking on, his palmar grasp, plantar grasp, his feet moving, Babinski reflex, tonic neck flex. See if he'd move. Does he have any trunk curvation? General appearance of him. Movement of size, circumference, how are his fontanelles? Are they sunken in like he might be dehydrated? Are they bulging, right? Does he have any hematomas on his head? Does he have anything where, they used forceps on him, so maybe he has those grip marks from the extractors? Those kinds of things. You would start to look at function of facial, hypoglossal, glossopharyngeal nerves. So is he moving his tongue? Is he moving his mouth? That's going to give you ideas as to whether or not he has good nerve innervation, whether his nerves are intact. How's vagus nerves doing? How's his palate inside of his mouth? Does he swallow good? Does his tongue, is it a normal shape, right? External ear, hearing, just make a small noise, see if he kind of startles to it. Can he hear out of both ears, right? General placement of his eyes. Are they wide set? Are they narrow set? Do both of them seem to react to light? Inspect the cornea. Does he have any, drainage or leakage in the corners of his eyes, his conjunctiva, right? Does he move? Does he follow something when you hold it in front of his face? Does his eyes track it? So as you move on down, you'd start to look, make sure his clavicles were intact, right? And both of his shoulders, he didn't have any trauma during childbirth, right? And he got something broken and it just got missed. Expansion and retraction of his chest, right? And his chest wall, does everything seem intact and it seems normal? One side's not moving more than the other, right? Listen to heart tones. Look at his abdomen. Is it soft, tender? Is it just round? Does he have any pain when you gently push in the different quadrants? Does it seem like that's good? Down to his pelvis. Look at his extremities, his lower extremities. Do they look even and pink? Do they have any deformities to them? Or his legs nice and straight? Or his arms nice and straight? Does he have any jaundice, right? Is his skin yellow or is it pink? Has he had a good bowel movement? What does his diapers look like? Are they wet? Is he getting enough fluid? Is he getting enough milk? Is he bottle fed? Is he breastfed? If he's a male child, we would expose his diaper and look at his penis and his scrotum. Make sure that they were, they were normal, that there weren't any problems there. Female child, clitoris, vagina. There again, is it normal shape and size? Does it look like it has the proper function? The child rolled over, you'd look at their buttocks, you'd look at their anus to see if that was, is it intact? Do they have an anus? Does it look like it's of the proper function? Do they, have a good strong cry? Do they feel like, they're not lethargic and they're getting enough to eat and they're awake and alert? So you do that and then go over the assessment again, make sure you didn't miss anything. Ask mom, how's the baby been doing? Is he feeding good? Is he latching good? How does he do when he's with you? Observe the baby with mom. How do they interact? Those sorts of things.